it's just a pleasure to be here. CHS is one of the resources in our community that is stellar and offers resources and therapeutic support in ways that a lot of places in the country don't have. So it's important not to take it for granted that programs like CHS really are a fantastic resource, and I hope you all know about it or learn more about it as we go forward. So today I wanted to focus on emotional sobriety, and it's kind of a mouthful to say emotional sobriety as a catalyst towards sustainable sexual sobriety. But what I want you all to know is that I came to this topic because it affects me personally, and it affects my clients, of course, every single day that I'm in the office. And so it's something that applies to all of us in one way or another, and it's something that applies to all of our clients in one way or another, not just sex addicts. It's really something that we can all practice. And it truly is a practice. It's an awareness and it's a practice. And we're going to talk more about what I mean by that as we talk more about the topic. I also want to recognize that you all bring your own clinical talents, your own wisdom, and your background to today's discussion. And I really want this to be a discussion. It's not just a one-way street lecture. It's really meant to be something that we can talk about together. And what I recognize is that you all are working with your clients in a way that is helpful and that hopefully is moving your clients forward in terms of their healing. And hopefully today what we talk about can complement whatever you're already doing. So I always say, take what you like and leave the rest, but this is an opportunity for us to talk about a subject that doesn't always get talked about. So I want to share a little bit about my own background, and Douglas gave you the clinical background, but many people don't know that sex and love addiction is also my personal background. So I went into recovery and I went to my first 12-step meeting in 1994. So I was only 6 years old at the time. But right, I know. I was a quick learner. I was very precocious. But what happened was, you know, I in my own addiction and my own compulsive behavior, I hit bottom in a way that actually was a beginning for me. It was a starting gate. And nowadays, at my meetings, I still go to meetings, I have a sponsor, I am a sponsor, I'm involved in the 12-step community, so I have a little bit of that bias, if you hear that in my presentation today. But basically, I am a sex addict, but I consider myself to be sexually compulsive. I know it's a controversy in terms of semantics and what we call these things. To me, it doesn't matter whether we call it sex addiction, sexual compulsivity, problematic sexual behavior, or out of control sexual behavior. There's suffering out there, and that's really what counts, and we're all here to help people suffer less, right? So, so I am a sex addict, I am a love addict, I am a love avoidant, I am a codependent, and I also am a recovering perfectionist. And even though it's kind of funny, when I was a kid, it wasn't so funny. It was very painful. And I appreciate
I struggle with the same damn thing.
Yeah. Yeah, yeah. No, not at all. We're laughing together.
Okay.
We've got to laugh, right? If we didn't laugh, we'd be in big trouble. But the thing about it is, it's really more about what that is underneath, right? And I call that brokenheartedness. I call the suffering brokenheartedness. And we're going to talk more about what I mean by brokenheartedness, but I try not to pathologize. I try not to categorize or label. I'm much more interested in what's going on underneath and how can we heal that part of really the human psyche or the broken heart. So I want to just start with that disclaimer that the words are secondary to me, but really the lens that I look through, and I think that CHS also has this lens, although they have lots of lenses, which is really fantastic that they're so multifaceted, but I do look at sex addiction or sexual compulsivity as attachment ruptures and intimacy challenges. in that order, of course, because the attachment ruptures come first, and then the intimacy difficulties are the result. And I decided to write this book. It took me about 5 years from beginning to fruition. It just was released in June. And the reason I wrote the book is because I felt like we didn't talk a whole lot in our field about what you do once you stop the destructive or self-destructive behaviors. We're starting to talk more about it. The dialogue is growing. But things like emotional sobriety, grief, shame, narcissism, nervous system regulation, for whatever reason, those things seem to get somewhat overlooked. And I'm so glad that colleagues of mine are talking more about these things. I think we've come a long way, but we also have a long way to go. And so I wrote the book really based on my own passion. I didn't even know what a passion project really was until I got into the process. And it's a lot of blood, sweat, and tears, I'm sure you know, and I don't have to go into the writing process with you. But it was something that I knew I felt compelled to do. That was a healthy compulsion, to write the book and really keep going with the idea of what are the tools and strategies that are not being discussed, and how can that be brought to a larger population. So I also believe that even in this day, and I just came back from the SASH conference, the Society for the Advancement of Sexual Health. We were in St. Louis, and St. Louis is a very different part of the country than Los Angeles. And there's still a lot of stigma around sex addiction in many, many parts of the country, even in parts of Southern California. And there's still a lot of suffering. And so my effort, my hope is that I can put a dent into the stigma and into the suffering. Which brings us to today's presentation. And by the way, if you have any questions as we go along, please just shout them out. I'm really open to any questions that you might have for me. Okay? So let's get started. As I said, this is a mouthful, but basically it's about emotional sobriety as a tool towards not only sustainable sexual sobriety, but fulfilling, satisfying, expansive sexual sobriety. Because it's one thing staying sexually sober. In some ways that's the easy part, but the difficult part is how do you find a life that's really full of passion and meaning and purpose, okay? So let's see. Today's presentation is that we're going to talk about brokenheartedness, like I mentioned before. We're going to talk briefly about what sexual sobriety really is, even though many of you already know. Then we're going to segue into emotional sobriety. And I have to talk about nervous system regulation. And the reason I say I have to talk about it is because I've been immersed in SE, somatic experiencing, and brain spotting for so many years, and there is no emotional sobriety without nervous system regulation. If the nervous system is dysregulated, it's impossible to feel emotionally sober. So that's why I brought this into our discussion today. Okay, so can everybody see these photos? Mm-hmm. These are taken from the 70s, so they're a little fuzzy, but I'm going to introduce you to Nicky and Rose. So Nicky was my brown and white Siberian Husky with 2 different color eyes and a clover leaf on his forehead. He was gorgeous, and he was really one of the nervous system regulators when I was growing up, because our family was very chaotic. And he just kind of hung in there and was so consistent and so loving that I had to bring him in to show you that I believe that pets, as much as people, are some of the most healing kind of entities or creatures that we can possibly have in our lives. On the right is my grandmother, and she was my mom's mom. And Rose, this is taken, by the way, on the Atlantic City Boardwalk. We used to go down there together and hang out and just do nothing together, basically. She was one of the most unconditional people I've ever met in my life and may ever meet. And I bring her into this discussion because, you know, I come from a background of brokenheartedness. We all do in one form or another, right? It's not like anybody can really escape what brokenheartedness could mean to you, right, at one time or another. And, you know, without going into all the details, there was just a lot of problems in my family. I mean, I think my family loved each other. I think they did, but they had no clue how to love one another. And so it was this gap between what the longings that I had for unconditional love and what was available. Now, I bring Nicky and my grandmother into the room because I don't know where I'd be without them. I don't think I'd be here today. You know, I think I'd be off in my addiction or who knows. But I want to say about them is that ask your clients, if you don't do this already, ask your clients if they had an emotionally reliable person in their childhood. And then be sure to ask them, did you have an emotionally reliable pet in your childhood, right? Because what we're looking for is, was there some kind of secure attachment? And chances are, when they can locate that resource within themselves, that memory, you've got something to work with. Because you can come back again and again and again to that part of their heart. If they say no, and many of you and myself have had clients who unfortunately say, I can't come up with anything, we're truly starting from scratch. And so their love template is pretty hollow. And so we're starting from a place of really the therapeutic relationship in the room being the very first consistent, unconditional, loving experience oftentimes, which isn't a bad thing, it's just an uphill battle. It's harder work for the client. So that's Nicky and Rose. So brokenheartedness, like I said, I don't really believe in pathology anymore. If I'm talking to a colleague or if I'm trying to explain something clinically to a professional, I might use a diagnostic category. But because I come from a trauma lens nowadays, I don't want to diagnose anybody until their trauma has resolved, because they're going to look very different from the time they come in to see me until we do some trauma work. So we all know the kind of brokenheartedness that we as individuals have experienced, and we all know the kind of brokenheartedness that our clients bring into the office all the time. And this is not an exhaustive list, but this seems to be the most prominent areas that I see. And trauma could be an umbrella idea, by the way, and then underneath all of these things are types of trauma. But this is just one way of starting to look at the idea of, where is the heartbreak? How do we, in a sense, do a heartbreak inventory to find out where those ruptures were and where the trauma work needs to begin? Okay, so what I always say about the brokenheartedness is that it doesn't matter whether it happens before or after the sexually compulsive behavior. So for instance, we all know that porn, especially among teenagers and younger, unfortunately, is an epidemic, right? They may not have a traumatic background, but they fall into porn, they get compulsive, and then what happens? They're traumatized. Their poor little brains are hijacked. And so, like I said, it doesn't matter whether there's trauma before, because I don't think there's one size fits all when it comes to what we see. And again, it doesn't matter whether it's before, during, or after. What matters is, what are we seeing in front of us in the office, okay? So I remind us that it's a form of invisible suffering, but it's also a huge opportunity to learn about oneself and discover a healing path. I want to give sort of an example of something. So because I go to meetings regularly, I see a lot of folks who have time away from their bottom line behaviors. They might have years, but underneath of it, they'll be talking about profound loneliness, or they'll be talking about rage, they don't know where it comes from, or they'll talk about, just intractable anxiety and fears. And we all know as clinicians that that's the trauma that hasn't been worked on. But I really want to remind you that there's a lot of folks out there who are kind of the walking wounded, who are invisibly suffering, but underneath of it are hungry for more support. Okay? Okay. No, if anybody knows the name of these birds, this breed, let me know. I call them lovebirds. Does anybody know what kind of birds these are?
Not parakeets.
I think they're a version.
They look like a kind of parakeet.
That's the natural color?
I did not edit this slide. There's the natural color. When I was in Australia many years ago, there were a lot of colorful birds. So I think these are maybe from that part of the world. I call them lovebirds because they're just so cozy with each other. And the reason I love this slide is because they literally have each other's back, right? And that's what we're looking towards with our clients is where are these emotionally reliable, emotionally dependable relationships that can develop over time. It starts oftentimes in the office with each of you, which is really important to remind yourselves that sometimes if they come from a desert and they come into a warm heart that you provide for them, that there's a new experience available. And by being consistent, by offering, and I believe this, I think many of you would agree that we really are offering love to our clients, right? And in brain spotting, we talk about, this is just an aside, we talk about the neurobiological attunement, right? So the attunement to the nervous system and the relational attunement. And the relational attunement, because we don't talk a whole lot in brain spotting, is such a heart-to-heart kind of experience. I hold love for for all my clients, but in brain spotting even more so. It's palpable. But what we're moving towards, and this isn't the only antidote, by the way. I don't want to make it sound like this is the only way to heal brokenheartedness, but I do believe it's one of the greatest healers. So we're talking about moving towards secure attachments, moving towards love, moving towards deeper connection. And what I want to share for a moment about secure attachments is something I heard recently, which I thought was brilliant. It was a group therapist from Rochester, New York. He said that our job as therapists is not to create secure attachments for our clients, or not to move in the direction of having to build secure attachments. Our initial work is to work on the barriers that our clients have towards building secure attachment. So if we don't work on the barriers, right, it's very difficult to bypass that and go right to, let's build some secure attachments for you. So if a client is, let's say, ambivalent about coming in to see you, that's one of those moments of opportunity to work on something in them that's getting triggered, right? Something that they're scared about, something that they're interested in engaging, they're interested in attaching, and at the same time, it's terrifying more than likely. So the idea of looking at the barriers towards secure attachments is very, very important. For me, that was very, it was like, what do they do? Psh, like, it was one of those moments. And so I just mentioned that because I thought it was very, very, very important. So, let's see. All right, so I'm not going to spend a whole lot of time on this slide because I think most of you know what sexual sobriety is. But I'm going to use these Sex and Love Addicts Anonymous categories. In Sex and Love Addicts Anonymous, they talk about top-line behaviors and bottom-line behaviors. It's very simple in some ways. And top-line behaviors are those things that are enriching to you, and bottom-line behaviors are the things that you absolutely do not want to be doing. And that's how we count time in SLAA, is according to whatever you've decided with your sponsor, with God, that you feel like these are the behaviors that are depleting my life, destructive, self-destructive, etc. So with a sponsor usually, if they don't have a sponsor, maybe with you, with a therapist, with a coach, the sexual recovery plan is foundational. And of course, with food, with money, with sex, we're not talking about abstinence models, we're talking about harm reduction and dealing with the issues that are causing the major problems. But as I said before, sexual sobriety is really the starting gate, the very, very beginning. Like when somebody stops their behaviors, it's like a baby, it's like I'm just in my infancy. But then once the sexual sobriety takes shape and someone gets some time under their belt and they've stopped those behaviors, that's where emotional sobriety takes place. So I am going to put you guys to work for a moment. And I'm going to have you talk, you could just talk to the people in your row. And some of you may know more about what emotional sobriety might mean, and there's no right or wrong about this, by the way. And some of you might be hearing emotional sobriety for the first time, or you don't know a whole lot about it. But I'd like you to talk with one another and just share what you think emotional sobriety is about. And we're just going to take about 3 or 4 minutes to do that.
Hi, I'm Nancy.
So what happened with the energy just now? What did you notice with, any theories about what happened?
It expanded.
Connection, yeah. Honesty, yeah.
We got a chance to share.
Yeah,
and
yeah,
hear.
yeah. And my hunch, in addition to all of that, is that the topic is a buoyant topic. We're not talking about heavy, things that weigh us down or burden us. We're talking about something that's buoyant and something that's hopefully resilient. So, so with that said, what did you come up with? Just a few people. What were a few ideas that seemed to rise to the surface? Please.
Danielle said self-care.
Self-care, for sure. Yeah. What else?
Boundaries and regulation.
Okay, boundaries and regulation.
Down.
Boundaries and regulation, for sure.
Honesty and assertiveness with a partner or just with the self.
Honesty and assertiveness with a partner or with oneself, or both, of course.
Right.
Anything else?
We discussed the non-cyclical or non-swinging nature of it. There's not always depleting versus replenishing. It's just that it's self-generating or regenerating. I should say.
Okay, yeah. So self-generating, regenerating. Okay, what else?
We talked, we didn't really say these words, but an increase of distress tolerance.
Okay, and did you say an increase in distress tolerance?
Yeah,
Yeah.
the ability to deal with difficult
Yes.
situations without
Yes.
becoming overwhelmed or
Right.
moving into the swings.
So an ability to deal with difficult situations, basically without being overwhelmed
Yeah,
and
or
difficult emotional situations. Yeah, for sure. So go ahead.
No, I was just saying it's like the ultimate goal. Like
Yeah.
once you achieve that, then just everything else in life.
Yeah. Well, it's the ultimate goal, and it's lifelong, isn't it? We're not talking about something we just do homework and we do it for a week or two. We're talking about a lifelong awareness, right? So I always am touched by the answers that come from you guys, because you just came up with a better definition than I did. But there's lots and lots of definitions, so there's not a right or wrong. In my book, I was able to borrow from Dr. Tian Dayton, who, if any of you know her, she wrote a whole book on emotional sobriety, and she kindly allowed me to use some of her characteristics of emotional sobriety. But I have a lot of different feelings about what emotional sobriety is, and that's what we're going to talk about right now. And let me just ask you a few rhetorical questions. So how many of you have clients in recovery who say things like, no matter what I do, I can't seem to relax? Right, we all know them. I'm constantly anxious, like I'm crawling out of my skin. I just can't get comfortable with myself. And when I'm stressed, the first thing I think of is getting high or doing something compulsive. I know it's not what I really want to do, but I believe it will give me temporary relief, right? So our clients oftentimes are really saying to us, I just don't feel emotionally sober, right? I've given up the behavior, I may have given up the substance, but I'm still miserable. Yeah. And one of the questions I ask my clients is, when do you feel most like yourself? And the reason I ask that particular question is because it's very subjective, and only us as individuals and our clients as individuals can identify what that means. When do I feel most like myself? So I did interviews as part of my book, and these are some of the answers that I got. When do you feel most like yourself? Susan said, when I'm creatively expressive, when I'm writing, when I'm singing, when I'm dancing, when I'm doing artwork. Robert said, while taking a long walk, being out in nature. Alex said, and these are not real names, by the way, they are real people. Running a few miles really makes me calmer. Meditation is also a reset button for me. A lot of times I get into a trance of suffering and then want to act out. But when I meditate, it's like I see it. I see what I'm doing and it's painfully obvious. It wakes me up. And Colin said, when I'm consistently working my program, using the tools, when I'm not making somebody else or my job my higher power, when I'm with a friend who sees me and supports me and can be present and reflect with me. So these are all examples of people who are practicing emotional sobriety, who are moving in the direction of awareness and catching themselves when they're not emotionally sober and making specific choices, sometimes in program we call contrary action, to feel more like ourselves again, okay? So with that said, these are just some ideas that I put together. So emotional sobriety is the capacity to experience the fullness of life, not just life, but our internal world and the external world. It's a resilient, resourceful, regulated state of well-being. And like I've been saying, it's when you feel most like yourself, whatever that means to you, and feeling as comfortable in your own skin as possible. I know when I started program in the mid-90s, I did not feel comfortable in my own skin. I put on a good facade, I compartmentalized pretty well, but I was really uncomfortable and lonely inside. And so I love that question because it seems to be something that I can come back to again and again. Yes?
You said uncomfortable and lonely, but I feel like it's two separate things. Uncomfortable, one side, and then lonely could be another separate issue.
Sure. Loneliness, actually, I'm glad you raised that. What is your name, please?
Melinda.
Hi, Melinda. So loneliness is a natural feeling, right? And so if we become more comfortable with all of our feelings and they don't cause that addict mind or whatever we want to call it to go act out, then we're more comfortable with the uncomfortable, right? So I love what you said, absolutely. Because all of our feelings, sometimes I'm not going to talk about dysregulation in a few minutes, but yes, loneliness is not always about discomfort, okay? So I always like to come up with things that I can remember. So these are the 4 R's, which are my ingredients of how I remember emotional sobriety to be. This is a little different than Dr. Dayton's research, but it's about being able to relax, regulate, respond, and relate. And when I'm talking about relaxing, I'm talking about the art of relaxation. I'm not talking about vegging in front of the TV, although there's nothing wrong with a little Netflix, in moderation, of course. But how many of us, I'll ask you, how many of you feel that you are able to relax when you choose to? And I'm talking physiologically relax. Yeah, how many of you are good at relaxing? Yeah, and how do you do that? Is there a particular method or?
Reading.
Reading, good. Anything else?
Music.
Music, for sure.
Taking a walk.
Walking, nature.
Yeah, same thing. Walking.
Yeah. So really why I mention this is because a lot of our clients come in and don't know what relaxation even feels like. And so in session, if we can do a little grounding and orienting, if we can do a little breathing, a little resourcing, that's what I'm talking about. We're going to talk about regulation in a moment, so I'm going to skip over that and respond. So I have to share a quick story. My husband started eating sunflower seeds recently with the shells on them, so you have to crack them, and you know where this is going. So it's already bothersome for me, but I'll tell you where it comes from. My mother, may she rest in peace, was a big sunflower seed eater. She would sit in bed, smoke her cigarettes, eat her sunflower seeds, watch TV, and read the newspaper. And when I would go in to say goodnight or to visit, I was pretty invisible. And so sunflower seeds have a particular trauma reaction, even to this day, not huge, but a little bit. And what I've learned to do with this example is to respond rather than react. And what I do is I walk away, I give myself a little time out, I breathe. Sometimes I call someone in program and just download some of it. And then I bite my tongue first, because if I say something too quickly, it's going to be a mess. It's not good. And then I just come back and eventually have an honest conversation about it. And we've come up with some ground rules around sunflower seeds, so don't worry, we've worked out some boundaries around. That's right. Different parts of the home. I can't be in the same room. Maybe someday, but not yet.
It's okay.
And then the last thing is one of the most important things of emotional sobriety. So I believe that disconnection and profound loneliness are two of the hallmarks of folks who come into recovery for sex addiction. And so connection to self, connection to emotionally reliable people, and connection to a power greater than oneself, if somebody has that belief system, are the three pieces of relating that, for me, make a huge difference, because I don't feel so alone. And so, I think that this idea is not the whole 9 yards, but it's a good head start for most people to start to consider these 4 different emotional sobriety skills. Okay, so I want to share just a quick story about a client. It's a composite case study, so it's not a particular client, but this is also from my book, and it relates to emotional sobriety. Growing up in a wealthy family, it may appear that Jason had everything, but most of the time he was left with a nanny, leaving him starving for love and attention from his parents. When he went away to boarding school, he found out that his father had multiple affairs, and then his parents went through a really messy divorce. As a teenager, he was moody and suicidally depressed, and that's when he discovered porn. Jason found a way to temporarily avoid the pain through excessive masturbation. He had no idea that pornography would be so intoxicating, and before he knew it, he was using porn many hours each day. It's been more than 15 years since Jason first found porn. He's now been sexually sober for 18 months, and his longing for a deeper connection is stronger than ever, which feels exciting but also terrifies Jason. Being emotionally abandoned at such a young age, in addition to the secrets and lies surrounding his father's infidelities, trusting others was a serious risk. He realizes now that relying on reliable people is essential to live a life with emotional sobriety. Okay, so in my somatic experiencing training, there is a trainer still named Kathy Kane, and she came up with the most fantastic definition of trauma that I've seen to this day. It goes like this: something bad happens, you don't know how to deal with it, or the nervous system doesn't know how to deal with it, and it gets stuck inside of you, right? Simple. So when something is too much to process at the time, it gets shelved in the subcortex. And the subcortex is actually really wise, because it's basically acting as a kind of like a warehouse. I think of the like Costco or something. It's lots and lots and lots of things get shelved into the subcortex. And the subcortex is really the emotional brain, we call it sometimes, and the neocortex is the thinking brain. We spend most of our time in the thinking brain. The neocortex is busy, but the subcortex is really where the trauma stays. And so somatic therapies, and I think they're all great, by the way, even though I'm trained in certain ones, they're all fantastic. These are the brain-body modalities that help release energy and help release the burden of what we carry in the subcortical part of our brain. So I'm not going to go into a whole lot of depth around that, but I just wanted to introduce that piece of the topic because I think it's so vital to keep that in mind. How many of you have seen this window of tolerance, as they call it? Okay, a few of you. By the way, this over here is supposed to say window of resilience. And I actually renamed it. I was a little bold because the window of tolerance is something that many people have heard before. But my brain didn't understand window of tolerance. I see this as a window of resilience. I think of it as the zone of where we feel most like ourselves. So in between the dotted lines is where we feel regulated, okay? It's where we feel the fullness of who we are, resourceful, resilient, regulated. If we bump up, that's what we call upregulation. If we bump down, that's what we call downregulation. It's kind of like an accelerator or a brake. And oftentimes, like if I have a client who comes in who's highly anxious, I'll talk to them about this and I'll say, you know, your idle inside, your motor seems to be running a little high today. Are you aware of that? And usually they are. But I talk to clients differently nowadays. There was a time when I was trained more traditionally where I didn't talk like this, but I'm often wanting the client to get some type of somatic awareness, some kind of awareness of what's happening in their body and in their nervous system. And oftentimes when they see this particular visual, this is in itself, they have some relief because they understand, oh, that's what happens. And my goal, my therapeutic direction is how do I come from a panicky place, let's say, to a more regulated place? Or how do I go from a shutdown place to a more regulated place? And that's really what, in a nutshell, what regulation and dysregulation is all about, is clients understanding when they're dysregulated and knowing that they have the agency to become more regulated. And of course, it's a much longer story than that. There's a 3-year training on SE, and come to Brain Spotting if anybody wants to know more information. I'm happy to share afterwards. This came from TRIM, by the way, the TRIM model. Elaine Miller-Karras, who's out in the Riverside County, also allowed me to revise her version of this particular slide. So It's here, it's in my book, you can look it up online, but usually they call it the window of tolerance. And somebody mentioned the idea of tolerance, and yeah, I think it's important to be able to tolerate what's happening inside of us, and I think it's important to feel resilient with the capacity for what's happening.
Well, I think both things are true. As we learn to have distress tolerance,
Yeah,
we tolerate more areas of distress, then we're building resilience
right.
into those gray areas or those where we would normally where clients or ourselves.
Exactly.
All of us are walking around emotionally dysregulated.
Right.
Just try driving on the 405, right?
Every day. But keep in mind that dysregulation, when it happens in a sustained way, is really a recipe for acting out. Because we can't stay dysregulated for too long without wanting to find immediate relief. So that's why this is a very important slide and visual for our clients. So does anybody know this expression, neurons that fire together wire together? Some of you are nodding. This is from 1949. I love that. Whoever this Donald Hebb was a genius. He was so far ahead of his time. And what it's really talking about is the well-worn path. The neurons, the synapses are really what we generally keep doing until we make a clear choice to try and take contrary action to do something different. So the well-worn path is the compulsivity. The new neural pathways, like finding people in your life who are emotionally reliable, is the recovery piece. So addiction and sex addiction are really a misfired attempt to regulate, right? It's actually clever. There's wisdom in acting out because there's an attempt to feel better. There's an attempt to feel less sometimes. There's an attempt to feel more, actually, at other times. But either way, it's an attempt to try and regulate. It's just not the most adaptive way. Okay. So this is my nervous system regulator of the moment. This is Bowie. And for me, I don't know about you guys, but for me, when I went into recovery, I thought I was the Lone Ranger. That was my role in my family, and it was my role in life to kind of do things all by myself. And what I know more and more and more is that our pets and our loved ones, even if it's just a handful of people or a handful of creatures, little guys, that's the long-term healing. And so I had 6 weeks alone with him recently. It's going to make me cry. And he, I can't tell you how much of a companion he was, and how much of an intuitive little creature he was. And he's believe it or not, he's a shelter dog. He came to us 3 years ago. And he kind of took over the house, as you can see. He just hangs out and thinks he owns everything now, which is awesome. I don't have the best boundaries with him, but that's okay. And co-regulation, or what we sometimes call mutual regulation, is what we do with our clients all the time. And that's why I wanted to bring this slide to you. I'm eventually going to bring him to the office. He's not quite ready yet, but he's definitely a therapy dog. Has anybody heard of Chelly Campbell? And yes.
Oh, yeah.
So Chelly wrote an awesome book, a page-a-day book, years ago called The Wealthy Spirit. And with Chelly's permission, I have been using this forever, which is swimming with the dolphin. Without going into the whole fish story, Chelly says that there's your people and there's the rest of the world. And it's your job in life to find your people. And dolphins, as many of us know, are amazing with one another. I mean, if we only, as the human race, were so loyal and loving and unconditional and looking after each other the way dolphins do. And And I think it was Stan Tapkin who talked about, in order to have secure attachment, we really need to know that somebody has our back and that we have theirs. And so this is what I was talking about before. It's our job as clinicians to resolve barriers to secure attachment, to resolve the barriers that our clients have, the fears, the ambivalence, the difficulties. And so cultivate the dolphin inside of you, cultivate the dolphins around you. And Kelly's right here with us, right? Yeah. Okay. So this is a picture that I took in Philadelphia last Christmas. And if any of you know Philadelphia, this is right near the Art Museum. It's actually a brand new statue. And I love this statue because, number one, my husband is from Spain, so anything in Spanish has an extra touch of nostalgia. But amor is really what regulates the nervous system. And many of you probably have heard of Johann Hari. He does a great TED Talk. And what he says, and I'm going to amend it slightly, the opposite of sex addiction isn't sobriety. The opposite of sex addiction is connection. So this is my contact information. I'm right down the street. If you have any questions at any time, if I can be a resource for you, please let me know. These are the two books. It's Not About the Sex is really designed for folks who are sexually sober and moving forward with their recovery. And I've been told that partners are really getting a lot from it, and that actually people with other addictions are also relating to it. And from now on, 7 Keys to Purposeful Recovery is a coaching workbook, which I also designed for folks who are clean and sober and who are looking to build a bigger, better life for themselves. So we have just a couple of minutes, I believe, and I'm wondering if anybody has any questions or comments that you would like to share with me.